Within the field of gastroenterology, there are routine endoscopic procedures, such as an upper endoscopy or a colonoscopy. And then there are other procedures that we consider more advanced that involve evaluation of the gallbladder, the bile ducts, the pancreas, or removal of larger growths. The most common procedures would be an endoscopic ultrasound, which is a high-definition ultrasound within the intestine. Another procedure is an ERCP, in which we put a catheter into the tubes that drain the liver and potentially treat blockages or biopsy these areas. We can tailor a lot of our approach towards what that patient wants. We would say there might be a medical management, or the other end there's a surgical management, and there's an endoscopic management. What are you as a patient most comfortable with? That's very, very interesting and very fulfilling for both the doctor and the patient. And then after that, when you do something successfully, it's great to see the patient after in the clinic and see a change in the quality of life of that patient, or a relief that something's been taken care of.